Hi everyone, I am Professor Dr. Shivani Mojumdar, Professor and Head of the Department of Anatomy, JM Medical College, ex-Professor and Head of the Anatomy, Calcutta National Medical College. Today, I shall show you how you can identify the different norma of the skull. Now the skull consists of different bones and the skull included the mandible also. Now when the mandible is not present, this is known as the cranium. Now this cranium is described by the different planes. Now what are the planes in front? This part is known as the norma frontalis. Now behind this portion is known as the norma occipitalis. Next, on the two sides, this portion is known as the norma lateralis. And if you make this feature, you will see this skull cap, this region is known as the norma verticalis. And you will see the lower portion of the cranium is known as the norma basalis exterior aspect, and this is the norma basalis, you will see, that is the interior aspect. So this is the inside and this is the outside of the norma basalis. Now I shall discuss one by one. Now you will see the norma frontalis. You will see this portion is the norma frontalis. Now in this norma frontalis you will see that the squamous part of the frontal bone, and this actually forms the forehead. You can all feel the forehead, and in this region you will see the big cavity, and these two large cavities known as the orbital cavity. Above the orbital cavity you will see the margin which is known as the superciliary arch, and you will see this is the supraorbital margin. The medial part of the supraorbital margin is actually it is shallow, and you will see the lateral part, it is actually sharp. So you will get when the two portion of the norma, two portion of the superciliary arch meet, this is known as the glabella. You can always identify the glabella. You see, we put the bindi in the region of the glabella. So why this glabella? There is formation of the glabella because of the underlying frontal sinus. So you will see this region varies from person to person. In female, it is less prominent because their frontal air sinus is less developed, and in male it is more prominent, this superciliary arch and this region. Next, what are the things you will see? You will see this is the frontonasal junction, and this is the nasal notch of the frontal bone. So you will see these two are the nasal bone, that is the very small one, this nasal bone. This is the most common bone which is fractured during the any punching action or all this thing. So this is the nasal bone, and here you will also get this is the maxilla, and in the nasal notch there is articulation of the frontal process of the maxilla. Next you will see on the lateral aspect of the maxilla you can see the zygomatic bone. So this zygomatic bone, it also forms the floor of the orbit. You will see the roof of the orbit is formed by the orbital plate of the frontal bone. You will know this is the frontal bone. Now this frontal bone has got actually one squamous part that forms the forehead, and there is an orbital plate which forms the roof of the orbit. Very important. Now on the orbital orbit, on the lateral aspect, if you feel it, then you will see there is a depression. This depression lodges the lacrimal gland. And in the medial aspect, you will see there is actually there is broken bone is here, but in the normal aspect, you will get this portion is occupied by the bone, which is the lacrimal bone. And here you will get that there is the situation of the lacrimal sac. So you will see this one, and medial part of the orbital cavity is formed by very thin plate of the ethmoid that is known as the labyrinth of the ethmoid. Next you will see the below the nasal bone is a big hollow. This hollow is actually demarcate the anterior nasal aperture. That means the other part is not bony, only this part is bony. And here there is formation of a spine where the anterior end of the nasal septum, it is attached with the means of the cartilage. So this is the anterior nasal spine. Now below the anterior nasal spine, you will get the alveolar arch. This alveolar arch formed by the maxilla. 8 teeth is incorporated in each side of the maxilla. So altogether there are 16 teeth. So this is the, you will see when there is the mandible, you also get the mandibular arch is also there, that is also alveolar arch. And here in the midline there is the symphysis menti, and you will get here the mental protuberance in this region. Now you see the elder always actually hug you by means holding this region of the mental protuberance. And there is actually a foramen which is known as the mental foramen. So this is all about the normal frontalis. Now come to the norma occipitalis. So norma occipitalis that lies behind. You will see now in the norma occipitalis, in the upper part, you will see this is the smooth area of the occipital bone. And occipital bone is that bone which when you touches the pillow, then actually occipital bone touches the pillow. So you see when you lie down, the occipital bone touches the pillow. So you will see in the occipital bone, the junction of the upper smooth part and the lower rough part, there is an eminence, which everybody can palpate in their own thing. This varies among person to person, and this is known as the inion. This point is known as inion. Now what is the importance of inion? You see from here up to the nasion, which I have mentioned you at the frontonasal junction, this is the length of the skull is measured. So this is very important, not only in the racial variation, but it is also some case of disease. That means that when there is the frontal bossing or there, this measurement is required in case of the childhood. So this is, you will see next from this external occipital protuberance, you will see there are 3 lines coming out. So these 3 lines from the external occipital protuberance, the upper one is not so prominent, but you can visualize this. This is known as the highest nuchal line. Above the highest nuchal line, the epicranial aponeurosis is attached. Next, from the you will see from the that is the point, there is the emerging of the superior upwards and laterally. This is very much prominent because there are strong muscle is attached. Medially there is trapezius, and there is the laterally there is the occipitalis muscle. Next you will get the external occipital crest, and from the external occipital crest you will get the line it goes upwards and laterally, that is the inferior nuchal line. And below the inferior nuchal line, the area is very rough, and that gives attachment to the deep muscles of the neck, which is not in your course. That's why I am not telling you. Next, so you will get there, this is the Norma occipitalis, and the side of the Norma occipitalis is bounded by two projection, and this projection is known as the mastoid process of the temporal bone. So you will see this is about the Norma occipitalis. So thank you everyone for watching this video.